Hi, good morning. My name is Dr. Samira Tahtawi. I'm an obstetrician gynecologist in North Carolina. I work with the OB Hospitalist group, and I'm here to share a story of a patient that I had the privilege of taking care of earlier this summer. So just some background. This was a very young first-time mom. She had just arrived from South America with very limited prenatal care. She was actually a refugee to the United States, and she didn't speak any English, but she engaged the father of her baby to translate for us, and she had declined using our interpreters. So when she'd arrived the night before I came on shift, and the following morning when I arrived, she was ready to deliver her baby. She did very well, and she began pushing, and she had an epidural. She was very comfortable, but after about 3.5 hours of making great progress, but getting very tired, understandably, we offered her a vacuum delivery, which she was very agreeable to, and without any incident, we delivered a very healthy baby without difficulty. She then continued to bond with the baby and do well, and shortly after the placenta was delivered, I noticed that she had some very brisk bleeding, which was more than what I would have expected at this moment. So I immediately engaged my staff to provide her with the appropriate medications to help her bleeding stop. However, that did not help. So the next course of action was to employ one of the newer devices that we have here at the hospital, which is an intra-uterine vacuum, which is inserted inside the womb, and it creates a nice contraction and a suction to the uterine wall, which then can really diminish the bleeding from the birth. So I was able to insert that easily, thank goodness, and it worked instantly, thank goodness. And the patient did not need to receive a blood transfusion. She did not drop her blood count to any appreciable level, and she was instantly able to sit up and breastfeed her baby and continue with her desired bonding that every new mother wants to enjoy. So this story is important because as an OB hospitalist, I get to witness every day how critical it is that we are in the field, on the ground, 24/7, providing instant care for patients who need emergency attention, which this case illustrates. The key thing about this story that was good was earlier in the day we actually had the rep for this particular vacuum that we use for the uterus, the intrauterine vacuum. She had come to the hospital to train the staff on this device, and I had popped in to just get some tips for providers, and so this proved to be invaluable at the moment that I needed to use it. So it was just very good timing, I guess, for this case. But it also shows how, as a hospitalist, we are on the cutting edge of knowing what's the best and what's immediately available to help our patients when they need care in seconds, not hours.